Without that Medicaid, I would be dead. Seriously, I would not be sitting here today.
In 2018, Trita Robinson's life was on the line. Arkansas had just become the first state to mandate that low-income residents on Medicaid work a certain number of hours a month, or they would lose their health care.
If you don't meet the work requirements the third month, then I was gonna lose my Medicaid. And I'm like, oh my God, what am I gonna do?
Now, Republicans and some conservative Democrats are threatening to hold the country's economy hostage by refusing to raise the debt ceiling unless Democrats agree to enact the same policy nationwide.
I actually think we should have work requirements. If we imposed work requirements...
Welfare to work, I support it then, I support it now.
Our proposal will also restore work requirements. It's time to get Americans back to work.
For millions of Americans on Medicaid like Trita, the consequences of fights like this are deeply personal. But their stories are often never told. So we went to Arkansas to understand the human impact of Republicans' plan to attach work requirements to Medicaid, what it would mean for the 85 million Americans who depend on Medicaid, and whether work requirements for healthcare actually get people back to work.
My medical condition is iron deficiency anemia, and I have low white blood counts.
Trita lives in a small town in East Arkansas. In 2016, she went to the doctor after feeling extremely fatigued and short of breath.
And she took my blood samples, and it came back where my blood count was like 0. She was like, how did you even make it into the office? She said, do you not feel like you're gonna pass out? And that's when she discovered that I had iron deficiency anemia. I made a decision of working from home because there were times where my iron was so low, I would take my laptop and actually work in bed with my laptop because I was just that tired. I score tests for foreign students, and I work when there is work. So when there isn't any testing for me to score, then I don't work.
Thanks to Medicaid, Trita was able to have health insurance. But a year later in 2017, her life would be put in jeopardy by politicians in Washington and Little Rock.
Very soon after President Trump took office, he announced his intent to explode, his words not mine, explode the Affordable Care Act.
The best thing we can do politically speaking is let Obamacare explode. It is exploding right now.
And the Health and Human Services employees announced that work requirements would be the way that they would explode one part of the Affordable Care Act.
Emboldened by Trump, Arkansas became the first state in the country to implement work requirements for Medicaid. First for people ages 30 to 49, and later for people ages 19 to 29. There were limited exemptions.
It required Medicaid beneficiaries to report monthly that they are working or doing some sort of community service for 80 hours a month.
And for the thousands of low-income people targeted by this policy, jumping another hurdle to access healthcare just wasn't possible.
My original thoughts about the work requirements was, oh my God, what is this? You've got to be kidding me.
A very common theme that we would hear from people is that they had no idea that these work requirements existed or that they even applied to them.
This is Trevor Hawkins. He's an attorney with Legal Aid of Arkansas, and he was the first person to inform Trita that she was going to lose Medicaid coverage if she didn't meet the work requirements. For 2 consecutive months, she failed to work enough hours to qualify. A third missed month, and she would lose her health care entirely.
I had to go to a cancer doctor to try to see if I had leukemia. Well, it turned out that I had a tumor, and my doctor had to convince me to have the surgery. And she told me, she said, Trita, I'm so frightened for you because if you don't have this surgery, she said, you're gonna bleed to death. You're going to bleed to death. The surgery was expensive. You're looking at $20,000, $30,000. If I didn't have that Medicaid, I would not be sitting here today. I would be dead, seriously.
In the end, Trita was able to work enough hours in the third month to keep her Medicaid, but the same couldn't be said for thousands of others.
About 3 months in, once people started losing coverage, That was when things got really hard. They would go to a pharmacy and try to get medications. They would be told that they've lost their Medicaid, and they had no understanding why.
Not being able to meet the 80-hour minimum isn't the only thing that caused people to lose their Medicaid. Many people didn't even realize they had to report their work hours every single month.
One of my clients, Adrian, he was working. He had the best job he had ever had in his life and was doing everything he was supposed to, but he didn't realize that he needed to report every single month.
The state had terminated Adrian's Medicaid, all because he didn't report his hours the right way. Without Medicaid, Adrian couldn't access his medications, and without his medications, he couldn't work.
He was told by his employer he couldn't work. It wasn't safe for him to. And so he lost the best job he had ever had and never got a comparable job back just because he didn't report every single month that he was working, despite the fact that he was.
For many of Arkansas's rural residents, access to the internet to report these hours just wasn't within their reach.
Arkansas, at the time and still does, rank among the lowest in the country for broadband access. There's people all across this state that do not have some easy way to get to a computer and report this each month. The work requirements, as implemented here in Arkansas, only serve to create just countless bureaucratic hoops for people to jump through. It oftentimes pushed people to just give up. It wasn't worth the time. Life at the poverty line is tough.
In 2018, Trita and 8 other Arkansans filed a lawsuit against the work requirements, represented by a team of litigators that included Jane and Trevor. The work requirements were halted by a court less than a year after they were implemented and ultimately were shut down. But the damage was already done. 18,000 people lost their health care. Half had serious trouble paying off medical debt, and over half were forced to delay care and medication because of the costs. While thousands of people in Arkansas racked up medical debt and lost life-saving health care, did work requirements actually get more people on Medicaid to work?
People who are on Medicaid are already working. The majority of them work, or they can't work because they are children, because they are caregiving, because they are disabled, or because they have a chronic condition.
And a major survey of Arkansas residents found no evidence of employment increasing in the short term or long term. So what's the point of work requirements if they have such disastrous impacts and no effect on whether people work? Here's Matt Gaetz with an argument that's pretty common among Republican lawmakers.
I am a big believer in work requirements. Able-bodied people who are working age, who are not disabled, who are not seniors, should have to go to work if they want someone else to pay for their health care. And if we did that, there's real savings on the front end. And if Joe Biden won't do that, then what he's defending are the couch potatoes over hardworking Americans.
Matt Gaetz referring to Medicaid enrollees as couch potatoes really shows what kind of person he is, doesn't it? We're talking about people who go out into the workforce every day, people who, as did a number of our plaintiffs in the work requirement cases, work despite chronic conditions.
Republicans are currently holding up debt ceiling negotiations so that they can pass work requirements on Medicaid and other public assistance programs on a national level. And if the debt ceiling isn't raised by early June, it would be a catastrophe for the economy. The case in Arkansas should be a lesson for all of us about just how destructive pursuing those policies would be for the 85 million Americans on Medicaid.
You know, we work for a living. We do what we're supposed to do in order to get Medicaid coverage. I just think it's just not fair.